Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is December 18th, 2020. As always, we'll start with the COVID-19 statistics. Worldwide, we have over 75.5 million cases and nearly 1.7 million deaths. In the United States, we have nearly 18 million cases and over 320,000 deaths. Last week, the U.S. was at about 15,000 deaths per week. Right now, we're almost at about 20,000 deaths per week. Daily, we're often, not always, but often over 3,000 deaths, and there have been a couple days that have been over 3,500 deaths. So it is serious. You may be wondering why we don't ever mention the recovered numbers in our report. Well, there are two main reasons. The first reason we've actually mentioned in a previous report. Recovered numbers are not accurate. Most health departments report a person as recovered after a specific time frame as long as they haven't yet died. This means that a person could still be gasping for life on a ventilator in the ICU and be counted as recovered. That's an extreme but very possible scenario, a much more likely scenario, in fact one that happens multiple times every day all across the world, is that long haulers are counted among those who are recovered, even though they're still struggling with various symptoms. Basically, recovered numbers are just total cases minus deaths with a couple weeks of delay figured in. Since studies put estimates of long haulers at over 10% of confirmed cases, any recovered numbers you see are terribly incorrect. The second reason that we don't report on recovered numbers is that our job is to educate and encourage people to live in a healthy manner. So recovered numbers don't actually educate because they're not accurate. That goes back to the first point. But they also do not encourage us to do anything to increase our health or the health of those around us. Recovered numbers actually encourage complacency. Those who deny that COVID-19 is dangerous regularly ignore the number of deaths and the seriousness of long-haul COVID symptoms while focusing on the recovered numbers. Their single-minded focus has caused massive damage to the United States response to COVID-19. So we feel that it is a responsibility to counter that. We need to make a difference here. So some may say that our approach encourages fear. The mainstream media has also been accused of that. In some cases, that might be true for the mainstream media. For us, we acknowledge that these numbers may cause fear in some people. We strive to include as much good news as possible, and we also stress pretty much every report we've stressed that we do have quite a bit of control over this pandemic as long as we follow certain guidelines. Years of research into risk has shown that people only really believe that something bad will happen if they can either easily imagine it or something similar has already happened to them. That explains why recent studies have shown that those who trust in science are usually more likely to wear a mask and they are usually more likely to treat COVID-19 as a serious issue. It also explains why those who already have a strong distrust of government more easily believe in the conspiracy theories about COVID-19. We're generally the product of our upbringing and environment. People can change, but it takes a lot of work or a major life event. We've probably all read stories about people who didn't believe in the seriousness of COVID-19, but then became seriously sick with it themselves or lost loved ones to it and ended up becoming advocates for following CDC guidelines. Experience tends to be a very effective teacher for most people, but it's usually pretty harsh. Learning from other people, also known as education, often takes more work, but it's not as harsh. So here at Plain English Public Health, we're trying to help people with education. We can't really provide the experience. We don't really want to provide the experience, as it's so harsh. But we are trying to educate, and so we're trying to use everything at our disposal because we know that changing minds is hard work. So while we definitely provide information and we try to provide as much hope as possible, we don't shy away from using fear or concern. Sometimes it's completely inadvertent, like the numbers. We don't try to give you big numbers to scare you. That's just the facts. But other times, we try to make our point clear that this is serious, and sometimes that causes fear. Though we believe that decisions should not be based solely on fear, fear can motivate us to take a good look at our current situation and seriously consider making changes. It can bring us to a realization about what's actually going on. And when we've realized that change needs to happen, fear should no longer be the main driver. At that point, we need reliable information and a desire to do what's right. That should be what causes us to change. So that's why we're providing all this information, along with a little bit of fear, concern, anything else to get us motivated. So that's our main purpose with these weekly reports. We want to provide information, but information by itself is of limited value. We want to help people do what's best from a public health perspective. We need to put it into action. We should all be doing what we can to help everyone live a better life. So now let me just step back from my soapbox here a little bit, and we'll continue on with the rest of the report. Just wanted to put that out there, though. So we'll start with a bit more information about how masks work. We've talked about this in previous reports, but this past week I actually came across an interesting article. It's down in the link, as in the links as always below the video. But it got me thinking, and it provided some more information that I didn't have before. That's the wonderful thing about science. New stuff comes up all the time, and sometimes stuff that's actually old but just hasn't really circulated much comes up. So let's go over some of those things as to why masks work, because we've talked about in the past the fact that virus particles are tiny. They're much smaller than any of the holes that you'd find in a mask. No matter how tightly you weave a mask, there's always going to be holes that are small enough for viruses to get through. It's pretty much required for us to be able to breathe through them, decently. So why do they work? We know they do. Studies have shown that masks work. Actual real life scenarios, whether it's Kansas City or elsewhere, they show that these things work. Masks work. So what's going on? Well, first off, virus particles are almost always inside of something else, usually water droplets. Those water droplets are large enough to be blocked by most masks. Second, multi-layer masks do a good job of having one layer cover the holes from another layer. Not a perfect job, but a decent job. Third, multi-layer masks also build up an electrostatic charge which attracts particles and traps them. Now, the thing that I found out this past week is that super small particles, like viruses, are subject to what's called Brownian motion. That's a scientific term for moving around in a kind of a random zigzag pattern because those tiny particles are hitting gas molecules. They're so small that they're actually affected by the gas molecules in the air, and so they're bouncing off of that. Larger particles generally just move in straight lines because they can just push aside those gas molecules. Because of the Brownian motion, super small particles are actually easier to catch in masks than slightly larger particles. Their zigzag motion makes them more likely to bump into the actual fabric and filter portion of the mask. The hardest ones to catch are actually the middle-sized ones, the ones that are too big to do the Brownian motion so they go straight, but they're too small, or they're so small that they just go through the holes in the mask pretty much. That's why N95 masks are rated for 0.3 micron particles instead of even smaller stuff. It's not because they can't get it to work for smaller particles, it's because they don't need to. The 0.3 particle ones, 0.3 micron particles, are actually right in that range where it's the hardest to catch them. And so that's why they aim for stopping those types of particles. That's also why you can still smell smoke and other scents while wearing a mask. The smoke particles and other scents are right in that same range, and so they'll get through, whereas a virus particle will not. Like I said earlier, studies definitely show that masks work, so the why they work may not be as important to you and me. But I, for one, always enjoy knowing why, and so I was really happy to see that article this week. So speaking about studies on masks, another one became available this week that looked at South Dakota. South Dakota has been one of the most anti-mask states in the nation, mostly due to their governor. Brookings, South Dakota, however, has had a mask mandate since the middle of September. At the beginning of the mask mandate, the county that Brookings is in had the highest per capita daily new case rate of the top 5 most populous counties in South Dakota. Once the mask mandate went into effect, new cases dropped sharply. Since then, the entire country has seen increases in new cases, but Brookings County is now much lower than the other highly populated counties in South Dakota. We keep seeing more and more of these studies that they look at it, they see which places are using masks, which places are mandating masks, and they compare them. And in almost every single case, those that have mask mandates or have high mask usage show lower per capita rates of cases. It's amazing. You would think that maybe there's something wrong with it, but no, it's science. That's what it is. We've had multiple studies that show the same stuff. So masks do work. Moving on to vaccine news, Pfizer's vaccine was approved last Friday after we'd finished recording our report. The first doses were given on Monday throughout the United States. Vials of the Pfizer vaccine that were supposed to have 5 doses in them have actually been found to contain 6 or sometimes even 7 doses. It is pretty normal to have a little bit of extra vaccine in a vial just to make up for any spillage or anything like that. But this is actually a little bit more than usual. But the FDA has approved using the extra amount in each vial so more doses can be given. They've said not to just throw those out or anything. They have warned, however, not to combine partial doses from different vials just to avoid cross-contamination. Moderna's vaccine has been recommended for emergency authorization. That happened earlier today, and so what that means is that it'll most likely be approved either today, sometime over the weekend, or probably at the latest by Monday. People could start receiving that vaccine as early as next week. One thing about Moderna's vaccine is that it only requires a regular freezer for storage, not the super cold freezers that Pfizer's vaccine requires. So that should make it easier to store in the smaller hospitals and clinics that don't have access to the really super cold freezers that you would find in larger hospitals and other special storage areas that have been made specifically for that kind of thing. In addition to Pfizer and Moderna, it's estimated that by February we'll have the AstraZeneca and Johnson & Johnson vaccines approved. Dr. Fauci has said that based on current vaccine estimates, he expects us to reach herd immunity levels by the summer of 2021. Now, his estimates, he was quick to point out, do depend on people actually taking the vaccine. If we have too many people refusing to take the vaccine for whatever reason, that's not going to happen. We're not going to reach herd immunity until much later. So please, everybody, once the vaccine becomes available to you, please take it. To help get vaccines to everyone, many retail pharmacies, including Walmart, CVS, and Walgreens, have entered into distribution agreements with the U.S. government. Those pharmacies won't have any say in who gets the vaccines, but they'll be available to help with storage and distribution. A major World Health Organization study has completed and shows that 4 medications that were originally believed to work against COVID-19 actually don't offer any positive benefits, at least not significant benefits. Those 4 drugs that don't work are hydroxychloroquine, which we talked about a lot back in the early pandemic, remdesivir, which originally we thought showed a lot of promise, lopinavir, and interferon beta 1A. As of right now, the only drugs that have been shown to work on COVID-19 through actual studies are dexamethasone and similar steroids. Those medications can only be used once a patient is showing severe symptoms, because using them on patients with mild symptoms actually ends up causing more problems than it solves. It is disheartening to hear of treatment failures, but we still have a lot of other possible treatments being tested right now. We've mentioned quite a few of them in previous reports, and that testing is ongoing, even if we don't hear updates very often about them. They are still going. They're still good for, most likely most of them will be good, or at least a good percentage of them will help quite a bit. Even if they don't fully cure people from COVID-19, even dexamethasone doesn't do that. What it does is it does help patients to have stronger bodies. Their own bodies are able to recover better. So there is that coming up with all those treatments that are being tested now. Also, the vaccines that we've been talking about will hopefully make it even unnecessary to have those treatments. Of course, there will be some people that are just not able to get the vaccines, and if they do end up getting COVID-19, then they'll need those treatments. And so it's still important that we keep working on those treatments, even if we have the vaccine. Thank you for watching the Plain English Public Health Weekly Report for December 18th, 2020. As usual, we have the links down below the video where you can go through those and find out what we didn't have time to talk about today, and also more information on what we did talk about. There are definitely some good articles down in those links today. Also, on a program note, next Friday is Christmas, so we won't be having the weekly report on Friday. I will be getting a report out on Wednesday instead. It'll most likely be a shorter report than usual, but I will make sure to have all the links still in that video also. So I'm Richard Greenland, and you have a healthy weekend.